Hello, my name is Dr. Dewan S. Raja. Today I will discuss about cervical vertebral levels of important anatomical structures. So let's start. Cervical vertebra 1, also called atlas. Here we have the beginning of the spinal cord. From the foramen magnum, the gap in the occipital bone at the base of the skull. Spinal cord begin from the lower end of the medulla oblongata that continued as the spinal cord at the foramen magnum. Axis or second cervical vertebra to cervical vertebra 3, we have the superior cervical sympathetic ganglion. We have 3 cervical sympathetic ganglion on each side of the cervical region. Superior cervical sympathetic ganglion, middle cervical sympathetic ganglion, and inferior cervical sympathetic ganglion. The superior cervical sympathetic ganglion is the largest among all 3 cervical sympathetic ganglions. Against the C3 at this level, C3 will get the hyoid bone. At the level of C3, C4, we have the superior border of the thyroid cartilage, the larynx. There is approximately, a little bit variation is always possible. Bifurcation of the common carotid artery into external and internal carotid arteries. We have the carotid sinus, that is the dilatation at the bifurcation of the common carotid artery. That is essential to censor the blood pressure. It maintains the blood pressure. Carotid body, again, that is also present in the bifurcation of the common carotid artery, that is associated with blood pH level and carbon dioxide level. Carotid sinus may extend up to the lower part of the to the internal carotid artery, but these two are present in the these are always present in the bifurcation of the common carotid artery. This is cervical vertebra. Okay, the anterior tubercle, we should have posterior tubercle of the atlas. Atlas has no body, we have lateral mass there. This is the dens of the second cervical vertebra. We have the transverse foramen here, transverse process there. Okay, on the other side we'll get the spinous process. The atlas has no spinous process, but it has posterior tubercle. Here is the posterior tubercle, spinous process of the T2. Okay, so here the zygapophyseal joint, facet joint, superior articular facet. Okay, we got that. Inferior articular facet here. And here we'll get the outline of the hyoid bone, outline of the thyroid cartilage. This cartilage may be calcified in the elderly person. Okay, so here bifurcation of the common carotid artery here at the level of cervical vertebra 3 and 4, upper margin of the thyroid cartilage. This is the thyroid cartilage, upper margin. Okay, vertebral level 6, arch of cricoid cartilage. This is the cricoid cartilage. From the lower border, we have beginning of the trachea, and this is the esophagus. This continued from the lower end of the laryngopharynx. Okay, we got that. And here, this is the laryngopharynx. It continued as the esophagus. This is the area for the cricoid cartilage that continued as the trachea. Okay, cervical vertebral level, important anatomical structure. Again, C5, C6 level, upper limit of the, the lower limit of the larynx. upper limit of the trachea, upper limit of the esophagus, okay, and here lower limit of the pharynx, lower limit of the larynx, upper limit of the trachea, upper limit of the esophagus. You have to remember that thyroid gland is located at the level of C5 to T1, but it varies depending on the descent of the thyroid gland. Some people may have lingual thyroid, but this is normal location. C6, at the level of C6, we have the cricoid cartilage, middle cervical sympathetic ganglion, vertebral artery entering the transverse process of the cervical vertebra 6. It passes through the transverse foramen or foramen transversarium of cervical vertebra 6, then 5, 4, 3, 2, 1. Then vertebral artery enters the cranial cavity through the foramen magnum, unite on the other side vertebral artery at the lower part of the pons and becomes the basilar artery. Okay. C7 will get the apex of the lung, level C7 T1. Okay. Inferior cervical sympathetic ganglion, the level of transverse process of C7, cervical vertebra 7, and the neck of the first rib. Inferior cervical sympathetic ganglion often unite with the first thoracic sympathetic ganglion and forms the stellate ganglion or cervicothoracic ganglion. And that's all about the cervical vertebral level and important structures. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. And have a nice day. Bye now.